It's great to be out here at the Ponte Vedra Vein Institute. If you haven't checked it out, yes, a new location here right off the Gate Parkway. And I'm here with Dr. Megan Deacon Casey. Good to be with you. And of course, the medical director. And we've got Crystal Boatwright, the physician's assistant. And I always learn so much from you, doctor. And today, though, we've got a big subject. It's called a DVT. What is that?
So a DVT is otherwise known as deep venous thrombosis. This is where a blood clot forms in the veins, and over time, potentially that vein and then that blood clot enlarges the veins. It can cause some pain. And the worst part of something like this that can potentially happen is that that blood clot can actually break off and travel to the lung, which is called a pulmonary embolism, which can be very dangerous.
Yeah, it can be deadly, right? Because we hear about the blood clots. We would hear more and more about that in the news.
That's right. It can lead to death.
Oh, okay. So there is some good news, though, you told me. All right, we'll be okay with this. So what are, first of all, the causes and symptoms?
Okay.
Well, definitely one of the main causes of a DVT is lack of activity, moving. So definitely after any type of surgery, that's why we want patients up and active.
That makes sense.
During travel, when we're really seated for a long period of time, either in a long car trip and or flight.
Oh boy.
You're not pumping that calf, so the blood is stagnant.
Well, this is the time your folks are traveling a lot. I've got a long plane ride ahead of me, so this is some great advice.
So everyone should wear compression stockings.
Okay.
So when you're traveling after an injury, if you're having any type of procedure, we recommend at least knee-high medical grade compression, and that helps to mimic the calf muscle, so it pushes the blood out of the legs.
Okay, so it's easy to find. They're called compression
Stockings, yeah, we have some in stock, and we definitely help fit patients. You also want to stay well hydrated. Anytime that you're not drinking a lot of water, if you drink too much caffeine or alcohol, that will cause dehydration, which can increase your risk of a blood clot.
Okay, very good. So we got that down. We know what it is and how to prevent it. What if we do come down with this or have a loved one that has it? What are their options, doctor?
So the options for treating a blood clot or DVT, usually the first line of treatment, we get the diagnosis, usually on ultrasound, and usually patients are placed on a medication, which is a blood thinner. There are many different forms or different types of blood thinners. That's usually the first step to kind of melt that blood clot pretty quickly so that it doesn't break off and cause other problems. However, there are multiple other ways that we can treat a DVT so that you don't get the long-term problems and chronic issues of a DVT.
So this has long-lasting health implications.
Absolutely.
So you have to nip this in the bud early, so it can cause big problems down the line if you do not.
That's right. So it's really important to seek treatment early if you realize that you've got calf pains, pain and swelling in the leg, and you suspect a blood clot, and you want to go in, seek medical attention, go to the emergency room, or you can give us a call, and then we can get you placed get you on the right treatment regimen. If you don't get treated over time, those vein walls can actually not work anymore. Those valves don't work anymore. And then you can develop chronic venous insufficiency. You can develop lymphedema. You can develop chronic swelling that happens in the legs. And it actually makes people's life a little bit harder because it's harder for them to walk around. The swelling is there. And then, of course, other forms of long-term sequelae of chronic venous insufficiency as well.
Very good. So what I'm getting out of this, take time for you, okay? If you feel that pain, because it can have big implications. But
Absolutely.
A lot of options available, not just medications, right?
That's right. Many options. So we're, as interventional radiologists, we can actually go into those veins and break up that blood clot and remove that clot burden so over time it doesn't cause problems for you.
All right, very good. Well, thank you so much for being on First Coast Living.
Of course, thank you.
And appreciate all the good information that really can help folks out there. And of course, we'll have much more on our website, and that's at firstcoastliving.net.